So my academic training is in clinical nephrology and epidemiology, with a focus on advanced chronic kidney disease, dialysis, and the systemic complication of renal dysfunction. And over the years, my research perspective has progressively expanded from a kidney-centered approach to a broader view that considers the interaction between organs, particularly the heart and the kidney. And my interest in the cardiorenal field developed primarily through the clinical experience. Cardiovascular disease remains the leading cause of morbidity and mortality in patients with kidney disease. Yet for a long time, cardiac and renal conditions were studied and managed separately. But in daily practice, however, it became clear that this separation does not reflect biological reality. The heart and the kidney are closely connected through hemodynamic mechanism, neurohormonal pathways, inflammation, and metabolic alteration. So recognizing this constant interaction led me to focus my research on the cardiovascular renal continuum, with particular attention to risk stratification, biomarkers, and therapeutic strategies that address the patient as a whole rather than isolated organs. AI has significantly expanded our analytical capabilities, particularly in handling complex and high-dimensional data sets. I think that in selected context, AI-driven models have shown strong predictive performance. However, traditional statistical approaches remain robust and interpretable. So the added value of AI must be demonstrated, must be confirmed through consistent external validation and clinical applicability, particularly in underrepresented populations such as patients with advanced kidney disease. I can see some barriers to implementation that may include data quality, external validation, as said, and clinician trust. For AI tools to be integrated into routine practice, they must provide transparent and actionable outputs, not just accurate predictions. So the journals focus on translational relevance and interdisciplinary perspective align closely with my own academic priorities. So that's the main reason that I become involved with RCM. And as an editorial board member, I particularly appreciate the effort to balance scientific rigor with clinical applicability that is really a hallmark of the journal.